I'm Liz Beddoe. I work at the School of Counselling, Human Services and Social Work at the University of Auckland. I've been teaching professional supervision to social workers and health professionals now for about 14 years. Our aim was to write a book that would work for our courses, so it very much reflects what we teach. We look at the history of supervision as a practice, we look at what it is, we try to define it as a practice of helping professionals to help people best by exploring their work and exploring the impact of their work on themselves. We look at the organisational context for supervision. We thoroughly address one particular approach to providing supervision that we feel works across the health and social care professions. We also look in some detail at how supervision can help students in training in clinical placements and training to be health and social care professions. And finally, the book looks at how do we create resilient practitioners, people who are going to be able to be exposed to the often traumatic and troubling situations that health professionals work with. How do people stay safe in their job, and how do we make sure that people are retained, because we spend a lot of money and a lot of time becoming health and social care professionals, and it's really important that we don't lose people early on because they have been unable to manage the stress and unable to achieve a kind of balance in their lives. I think why we felt it was a good time to write it now is that across the world in health and social care, there's been a revitalisation of supervision as a practice, partly because employers recognise that supervision is a really important aspect of quality in health and social care, but also because the research shows that supervision can help practitioners in stressful occupations to have some protection against the effects of stress and exposure to trauma. So as a process for helping health professionals and social care professionals to do better, supervision's become more and more important, and so more and more governments particularly are training people, prepared to invest in training, and so there's a need for literature that's based on research to support that training effort. One of the common misconceptions about supervision is that it's just checking, that it's kind of like you're the supervisor on the assembly line and that you're just checking that people have done the work that they're supposed to do and met deadlines. It's actually a lot more than that. It's actually quite a critical practice, because you're actually working with people who use themselves as a major tool in their work. And so you're actually working with people to see how they're coping with the work that they're doing, what skills they're using, maybe what areas of professional development they have. And because it focuses on the person, it is a relationship between two people, or sometimes in group supervision between a supervisor and a group of supervisees. There's a really important factor, and that's trust. Trust is at the heart of forming a really good relationship, and without trust, supervision can become just checklist work. To have the kind of quality and depth that will really help facilitate learning, there has to be a good relationship and there has to be trust. And we know that supervisees really value supervisors who are honest, give good feedback, but are also challenging, prepared to ask the hard questions. I think one aspect of the book that is worth mentioning is that supervision has to be supported by policy, whether it's government services or services delivered by NGOs. Somebody has to agree to pay for it, because obviously it does represent time out for staff away from the front line. And so we feel the book provides a really good argument for supporting supervision, for paying for staff in health and social care to have good supervision. And we hope that practitioners, managers, people working at the front line will be able to use the book as ammunition if new administrations, and there are a few of those about, decide to look at supervision as perhaps a practice that can be cut in the current climate of cost cutting. We think that would be foolish and short-sighted and lead to problems with turnover and retention for crucial staff, and we have difficulty enough in the Western world retaining good people in health and social care as it stands without cutting one of those things that really does contribute. So we're very positive advocates for supervision and for it being well funded and people to be well trained to do it so that it is effective use of time and money. One other area that we decided that was important to write about was the field of child protection and the role that supervision could play in child protection. Child protection is a public issue. It's a huge issue of social justice. People are really concerned about the well-being of children, and I think it's commonly understood that working as a child protection social worker in particular is a really demanding job. You're very much under public scrutiny. It's exhausting, it's stressful, and it's often heartbreaking. And so child protection social workers in particular, though I think it also applies to teachers, health visitors, other kinds of professions who work with children, requires particularly a resilience and an ability to stay hopeful and connected to whatever it is that drove you to want to do this work anyway. And we passionately believe, and there is certainly research that supports that good supervision is a key factor in retaining people in the job. There's been some research done in the States that proves that supervision provides some protection against exposure to trauma and continual stressful work. And so we wrote a chapter in the book that's focused, dedicated to supervision of child protection professionals, and that's a chapter we feel we could have written 2 books about, and it was very hard to get that into one chapter because there's an awful lot that we could say about child protection supervision. Colleague Allyson Davys and I wrote the book because we're passionate about supervision, and we wanted a book that we wanted to use with our students and with practitioners. And so we hope that the book will be really useful to practitioners, supervisors, people learning about supervision, other researchers about supervision. We want it to make a difference. It's a lot of work to write a book, and we would be really happy if we knew that people were using it and finding it helpful to them and finding it challenging to their practice and enabling them to kind of, I guess, become more confident as supervisors. We hope that people will engage with it and enjoy it.